With major provisions of the Healthcare Reform Affordable Care Act set to take effect in 2014, healthcare was the main topic on the first day of this year's Domenici Public Policy Conference at the Las Cruces Convention Center. Former U.S. Senator Tom Daschle, CEO of America's Health Insurance Plans Karen Ignani, and CEO of Molina Healthcare Dr. Mario Molina all spoke about healthcare at this year's Domenici conference. Dr. Mario Molina says he thinks the Affordable Care Act is going to be a good thing because the current system is so broken.
People are incentivized right now to do more. The more the doctor does, the more he gets paid. The more services that are provided, the more the pharmaceutical firm, the hospital, whoever it is, gets paid. And they're not really doing what is necessarily in the overall best interest of the patient or what is in the overall best economic interest. Everyone's trying to maximize their own benefit.
However, Dr. Molina contends for the average employed person, the Affordable Care Act probably won't have a huge impact on their lives.
For the average working person, I don't think you're going to see a big change. The probably single biggest change they will face will be if employers decide to drop coverage and have their employees obtain coverage through the exchange under a kind of a voucher system. But I think most people will not see a change. The people who are going to feel the change the most are those who are currently uninsured, and it will be a huge benefit to them.
Dr. Molina says with more people becoming insured, he expects more people to visit the doctor and emergency rooms, and he says that will have a huge impact because there aren't going to be enough doctors.
I think when people have insurance, they're going to access care more and they're going to expect more, and I think it will put a strain on the system. I think we're going to find that there are going to be people like nurses who are going to be taking on more responsibility, and even some lay people who are going to be trained to handle certain kinds of things that may not necessarily require a doctor or a nurse's attention.
According to Dr. Molina, the costs hospitals and pharmaceutical companies charge will likely continue to increase under the Affordable Care Act, and he says he hopes more people will get involved to try and figure out ways to lower the country's health care costs.
What we do know is the old system is just not working. It's not sustainable. We're paying far more than we should for health care and not getting the results that we should be getting. And it's going to be a debate that everyone has to get involved in. It can't simply be an issue of the Democrats and the Republicans fighting one another. And I think we have to stop looking to Congress to solve our problems, and I think we have to say, what can we as citizens do to solve some of these problems?
For KRWG, I'm Jared Andersen.